Thank you, everyone. I am very, very, very excited for many things tonight. We have a great speaker who we've had before, Kathleen O'Neill Smith. She will entertain us and give us guidance. I want to shout out to everyone at Johnson Compounding and the work of our representatives, Chris, Leah Verzi, Leslie Ferdima, chime in if I'm missing anyone on getting the website, which was an endeavor we started, maybe 3 or 4 years ago, even maybe pre-COVID, when we were going to do our first in-person annual meeting. And finally, I want to thank everyone for all the work that's been put in by the representatives and really reaching out to the community of New England to invite them and to participate and become. So, and who do we have tonight? We have Rhode Island, right? Rhode Island's here. And do we have any other New England states? So we're gathering people together because everyone's looking for functional medicine, and we want to be the go-to source for all of New England, which is why we've put the effort and work, and I want to thank everyone who did the work into getting the website up and running, and we will have that, and then we can work on and collectively decide and become members, contributors, and share information and use that information for each of your websites, interview each other, spread the word, and participate in the growth of everyone's practice. John, I'll turn it over to you at this point.
Hi, it's Leslie Ferdima from Hopkins Medical Group and the Greater Boston Functional Medicine Group. I just want to review with everybody quickly the agenda and then pick up on a few of the points that Dr. Hopkins has already made. We're going to hear from Chris Alley tonight from Integrated Therapeutics and from Carolyn Salvi from Vibrant America. And their presentations are going to dovetail with what Dr. Kathleen O'Neill Smith is going to teach us about fascia and the musculoskeletal system and how it's such an integral part of helping our patients stay healthy. But first, to pick up on what Dr. Hopkins said, we have a new format that we started in June where we are bringing in more of New England into the Greater Boston Functional Medicine Group. Tonight, we have in Rhode Island, Sally Davidson and Ted from Vibrant. We have in Connecticut, Nina with functional medicine practitioners in Nina Stout from Zymogen with functional medicine practitioners in Simsbury. And we have Leah Verzi from Orthomolecular with Integrated Health in Maine. So we're really excited to be growing and using our virtual technology, our Zoom, to bring in practitioners from all through New England. And as Dr. Hopkins said, we just launched today a brand new website, which we're going to walk through in a few minutes. But first, I'd like to bring in one of our practitioners from the Rhode Island group, Sally Davidson, who's a nurse practitioner in Rhode Island. And she's going to talk a little bit about, from her perspective as one of the leaders and organizers of functional medicine in Rhode Island, what we're trying to achieve by bringing New England together in a more robust way. Sally?
Sally, if you'll just unmute your mic.
Yep, there we go.
Thank
So I don't know if you guys can see me or if this is just audio, but
we have a picture of you, but I don't know if you can.
that's fine. That's fine. But I just really wanted to share the fact that Rhode Island had 18 people here tonight. So I think we win here, Little Rhode.
We want to clap for everyone in Rhode Island. Thank you so much for participating. Is John, John Santy there? I'll have to get the rheumatologist involved. All right, keep going.
So anyways, so here in Rhode Island, we've been formally gathering for about 7 years now. I've been in charge of it for about 5 years. And it pre-pandemic, our meeting, last meeting was, I think, 48 people. So we had, and for Little Rhode Island, that was a lot of momentum. And then the pandemic hit, and obviously, things turned south. So we're just regrouping. But I'm so excited tonight that we are all coming together. I went to Connecticut this summer to talk to the Connecticut group about the fact that we've been uniting. I've gone to a lot of the Greater Boston functional forums, and I think it's just wonderful that Greater Boston can become the hub, and we can be the spokes on the wheel, and then we can all kind of come together and have strength in numbers. Because I was just talking to these guys, when you go around the country, functional medicine is so much more prevalent and popular and accepted. And I think we have a lot of work to do here in New England with functional medicine and getting our name out there for the public to know, but also getting the powers that be to stop questioning compounding and things like that, and let us take care of these chronic patients. So I'm really excited about the website, and you're going to present how we all can benefit from being members of the Greater New England Functional Forum. So I'm hoping that we can get New Hampshire on board, and I understand Vermont is a very tough nugget, but maybe we can gather that. And hopefully we can have quarterly meetings and all take turns presenting and showing off our state's strengths. So thank you, everybody, for coming tonight. Appreciate it.
Thank you so much, Sally. We really, this has been, I must say, an act of love, and that's it. We just hired a new team, and the head of marketing said to me, he said, "You do functional medicine?" I said, "Yes." He said, "My wife's a nurse practitioner. I've never heard of you." I said, "Well, you've never heard of our website, the Greater Boston Functional Medicine, soon to be, hopefully, maybe New England Functional Medicine Forum." And he said, everyone is looking for that. He's a 35 to 40-year-old with kids. And he said, we want to go to a place where we're not judged, where we're safe, where we make decisions about all that is important, whether it's informed consent about vaccines, well, eyes wide open into therapies and medications. And, I literally had somebody, I live in an apartment building, and one of the workmen was in here, 29 years old, and he looked at me, he said, "Are you a doctor?" I said, "Yes." He said, "I'm 29 years old. I weigh 130 pounds, and they want to put me on a statin and diabetic medications." I went, "Okay, we need to review all of your lab work." And he was desperate to have somebody help him out of the quagmire of the automatic, you're going to start drugs at 29. So I think that it crosses all social barriers, any of our perceived conceptions of what patients want. When you open the door to the discussion, everyone is on board. It's 80 to 90% of patients go, "Doc, I never thought anyone would talk to me about this." So I really want to thank all of you. There's strength in numbers. We are the light. When the darkness is upon us, the light shines brighter. And that's how I think of our group, that we will be gathered into the light, because our intentions, as Leslie always said to me, our intentions are pure. We're going forward. So we have the Greater Boston Functional Medicine Group, finally, website up and running. So excited to see it.
Hi there. I'm here to take you on a tour of the Greater Boston Functional Medicine Group website, more specifically the provider directory. So you can get to it by the Find a Provider tab, and it'll take you to the directory. This directory is organized in a couple ways, the first being by categories. So this category section is a list of provider types. If somebody wants to search all of the nutritionists in your listing, they could click on the nutrition category and then apply the filter, and an entire list of all of the people who, providers who have designated themselves as nutritionists would be populated here. The next way that this directory is organized is by tag. So tags are supposed to be more specific filters for people to use that can be associated with a listing. So let's go back to the nutrition example. If somebody wanted a specialist that was weight management focused, they could further apply that filter, and the providers who are designated under nutrition and with the tag of weight management would then be populated here. This list of tags is created when there are listings associated with them. So there will be way more options for tags when there are more listings. But in general, the directory is a helpful tool for allowing patients to find the providers that are the best fit for their needs. Tutorial of how to add a listing. So you can become a member by either the option in the header or this button here in the banner. And that'll take you to the Become a Member page. The first step in becoming a member is selecting whether you are a group or a single provider. Groups are for practices with 2 or more providers that they'd like to have listings for, and a single provider is for an individual practitioner that's only going to have 1 listing. So you'll choose the option that best fits you, hit continue, and this is going to prompt you to sign up for an account. You'll click the sign up button here. With this, you'll enter a username. So for this group, it would be a sample group. I'll put in my email. And I'll create a password. I'm going to read and review the privacy policy and terms and conditions and sign up. From there, I'm going to check the email that I put, that I associated with the account for an email from Boston Functional Medicine Group. And then I'm going to follow the link that is in the registration confirmation. Within your dashboard, you can submit a listing. It'll have you reaffirm which plan you would like to choose. Again, if you're a single provider and you just want 1 listing, you go with the single provider option. If you are a group with multiple providers and want multiple listings, you'd choose the group option here. This will take you to the paywall. So it gives you the price, which is discounted until December 1st for $49 per listing, whether you're a single provider or a group for now. Those prices will go up after December 1st. And you can choose a payment method, which is conveniently Stripe, and hit Pay Now. And this will take you to a page to input your credit card information. For group practices, it would just be the group credit card, and that would get billed for each listing. And then the single provider, it's just the single provider credit card and just 1 payment for $49. Once you've input your credit card information, you will hit submit, and then it'll take you to this page with a summary of your transaction. At the bottom of it, you can scroll down to view your listing. And it'll take you back to this dashboard, at which point you can click Submit. When adding your listing, you'll put in your title, so provider name and a description. This is a description of you, your specialties, and any pertinent information you'd like to communicate to prospective patients and partners. If you have a tagline, you could put it here, and then you will select categories. So you select a category by clicking into this bar and then scrolling and picking all that are applicable to you. So you can pick more than 1 here if you'd like. And you submit another one by clicking back into this box. Tags, again, here are ways to further designate your specialties. So again, select all that apply, and you add more by clicking back into this box. With the tags, you can see all that you have selected by scrolling up. So you can see here that you have multiples. Then you can select whether you'd like to be accepting new patients or not, and continue down to input your contact information. So this is your outward-facing contact information the contact information that patients or prospective patients could use to get a hold of you. You can add a website if you have it, and any social media accounts that you'd like to associate with this listing. From here, you would add your address, or if you'd rather, you could enter coordinates or hide the map altogether, and upload any files, so photos you'd like to have displayed in your listing, or any videos that you'd like to add. The videos, you'd add a URL here, and then you're going to agree to the privacy policy and terms and conditions again before previewing your changes. Once reviewing all of your information here, you can either go back and edit it or hit continue to proceed. After you hit continue, your listing has been submitted for review. It may take up to 24 hours to complete the review, but when it is published, you will get a notification.
We invite you over the next couple weeks to check out the new Greater Boston Functional Medicine website. The point is, we would love to have you join, and we're offering a very special rate of $49 for an annual membership through the month of November. And really, creating a listing will allow you to highlight the array of services you provide, whether you're doing chiropractic, whether you're doing ozone, whether you're doing aesthetics. There's a large range of options to choose from to describe what you provide as a practitioner. And as more and more providers join the Greater Boston Functional Medicine provider list, we have a more robust list of practitioners that will attract patients to the website. So we really need you to support us. We ask for your support in the next month to please take the time to join the group, to create a provider listing for yourself. And as soon as you join and you create your listing, it's immediately populated and you can see it on the website. So we really worked hard to find technology that would allow you to quickly input your information and see it appear and make it very seamless for you. So again, we hope that you'll support us and join.
Thank you. Thank you, everybody, for inviting me here to speak with you and to just share any insight I might have. I was at A4M in South Carolina last weekend and shared a deck similar to this in the biohacking world with people like David Sinclair, et cetera. Dave Asprey, et cetera. So I really love the teamwork of your new website and what that offers, $49. It's a deal. I can't imagine that anybody wouldn't sign up for that and kind of work together as a team. It looks fantastic, and bravo for all of you for coming together to work together as a team, because it is the way that we create our dreams, right? It's a very hostile time in medicine, especially for what we do. And I think that's really important to note. And we have to come together. We have to support each other. We have to work together. We all have different approaches. Medicine is an art. And I applaud you all for coming together and trying to work as a team to bring your art forward to everyone who needs it. There's no one who doesn't need what we do, what you do. So bravo to you all. Thank you, Pat. Thank you, Chris. Thank you, Carolyn. I'm sorry you can't be here tonight, Carolyn, but thank you all. And I applaud you all for doing that. And certainly I will join and be a member of the group here. So pretty important. What am I doing wrong? Next. Okay. There we are. So today we are going to talk about rejuvenation, regeneration, pain. Pain is an absolutely enormous problem. The way that we treat pain is absurd. It makes no sense whatsoever with narcotics and other things. I think that the things that you already have heard about the diagnostics for pain and about the treatments for pain make way more sense than anything that we've done or I've done in conventional medicine in the past. So these are our objectives for tonight. It's going to be a whirlwind. I'm ready to go. I'm very familiar with all this. So it may be that you learn it a little bit over time. Hormones also are a treatment that I do. I'm not just into peptides. I'm also into hormones. I'm into lifestyle. I'm into food. I'm into nutrients and all of it. But we're just focusing on some of the newer regenerative therapies that we might think about in musculoskeletal disorders and in pain. So what is fascia? Fascia is the primary source of rejuvenation. All fascia is made up mostly of collagen. It's one of the most common proteins in our body. We make collagen every day of our lives. We use it to repair not just the soft tissue, connective tissue, i.e. the fascia tissue, but this is important because the connections, just like the connections that you want to make through your new website and through the Greater Boston Functional Medicine Group that includes New England, in order to communicate throughout the body, we need to understand that the source of communication from the top of your head to the tip of your toe is the fascia. So those connections are critical if we are going to treat pain, if we're going to treat brain, if we're going to treat gut, if we're going to treat anything. So linking one part of your system to another system in the body involves the fascia. So fascia is the most important and critical organ system. It is the largest organ system. We'll review how fascia is involved in pain, injury, and the healing at the cellular level. You must know what's going on in the cellular level, intracellularly, extracellularly, as Carolyn pointed out through her vibrant work. And you must be able to signal, as Chris pointed out, with curcumin and glutamine. We'll review use and combination of medicinal signaling therapies. These are therapies that are small molecules that signal healing throughout the body and connecting the different organs for healing. We'll look at nutrients, hormones, peptides, PRP, exosomes, mesenchymal stem cells, other modalities, whether it's photobiomodulation, shockwave, you name it. I don't think in terms of disease. I think in terms of physiology. And I think in terms of normal physiology versus aberrant physiology, and what is going wrong and how can I treat that symptom in the patient. The disease name is meaningless to me. It only helps me understand what the pathophysiology may be because I've done pathology, I've done internal medicine, I've done regenerative medicine, and I need to understand the multimodal therapies that I'm going to use in the new regionology tech framework. So the most important thing is, what are the patient's symptoms? Not what is the patient's diagnosis. What are their symptoms? And the goal of regeneration is to understand what is the origin of aberrant physiology for addressing the symptoms the patient comes in with. Just because we have a medicine, a supplement, a stem cell, a PRP, that's not why we use it. We use it to address the N of one. We are not in population-based medicine or public health-based medicine. What we do in functional medicine is personalized, precision-based medicine to the best of our ability. So we have to understand the genomics. And if you can measure genomics cost-effectively, as Carolyn pointed out, it is very important. The genomics does not dictate the disease. The genomics gives you a sense of the susceptibility, the possibility that that may be occurring in the patient. We have to understand epigenetics. We have to understand the food. We have to understand what, if there's no glutathione in a cell, there's a problem. Mitochondria will not work. You don't have glutathione, forget about NAD, forget about NMN, because it will only override a problem, an aberrancy temporarily. So you have to understand not just genetics, but also epigenetics, intracellular nutrients, and then we have to address it. The immune system is key. You will not create health without understanding the immune system. We have to understand the immune system. We have to understand how it functions. We have to understand the communication up and down the body, because the immune system is basically going to dictate what happens in the extracellular tissue, in the fascial matrix, in the extracellular matrix, and in the cell. It is all contiguous, and I will show you examples of that. If the immune system is being challenged and it goes awry, you can end up with inflammation, autoimmunity, or cancer. You will end up with oxidative stress. You will not be detoxifying. These are all interrelated. You cannot separate anything on this slide. It is all interrelated. Oxidative stress, detoxification, cellular health, what's happening within the immune system and what's happening within mitochondrial health. And it will start with what are the genetics, but more importantly, what are the epigenetics? So what is the lifestyle? What are the exposures? So if you think of the body or a cell as a seed, pardon me, I got to go back now. If you think of the body or the cell as a seed, as you see up here, each cell is representing a seed that's going to grow and become the plant that you want it to be. It is dependent upon the soil. What the micronutrient testing is telling you is about the soil. How healthy is the soil? Is it dirt or is it soil? Nothing's growing in dirt, but everything will grow in a really healthy soil that's nourished and that can feed the cells, that's watered and that has an appropriate pH and that can signal, to the roots, what's going on so that the organ, whether it's a plant or a human, can grow and thrive and flourish. And that's pretty important. So regionology with medicinal small molecule signaling therapies like a curcumin is going to help the body thrive. I'm sorry, let me just, okay, here. Screen sharing. I don't know what I did, but I will fix it. Here we are. So I go back to here and I share. Oh, goodness gracious. Thank you.
No problem.
Hmm.
Just hold on one sec.
This is really a work of art that's happening here in Waltham. I can promise you that. And I'm extremely impressed. Yeah, if I had a clicker, I wouldn't be making mistakes, but that's okay. Mm-mm. What's the best way to press the clicker?
Now, one sec.
Okay.
Can edit this out too.
I don't see it up there. Just what you all want to see is my face. Just give me a minute. We're having a little technical difficulty. Okay. There we are. And hopefully,
So I just have to full screen it and then.
now we'll just get rid of this for us and then we'll be set. Now I think,
Play slideshow.
pardon me?
Play slideshow.
This way. Oh, sorry, everyone. Just hold on a minute.
As soon as you give us credit.
Hmm?
So as soon as you give us credit.
Unbelievable. It's a great production that you're trying to do. You'll get it, I'm sure.
Ooh, share. There we go. I hope.
Good to go.
Okay. And now if we just go,
I hit another button.
yeah,
instead.
there and there.
Where the arrows are.
Can I use the arrow?
Yeah, so you can use.
Then I'll just
this
use the
one
arrow.
and that
Perfect.
one.
Okay,
Okay.
got it. Excellent. Honestly, you can't even believe how amazing these people are here. Gary and his team doing this work. incredibly impressed. So this is just a general pyramid that I made, looking at all of these things that are medicinal signaling. Look up the right side of the pyramid. Everything here, hormones are signaling. They're all signaling. They don't just act locally. You've got to think globally and think locally, and you've got to be understanding that things that you think are just acting locally are acting globally. And the best example that you understand is insulin. You put it in and you know that it ain't just acting locally, it's acting globally. Insulin is a peptide. There are smaller molecules that act locally and globally as well, including many other peptides, but hormones. But the goal is to get to peak wellness. You cannot get there without lifestyle modifications, without understanding intracellular and extracellular levels of nutrients, which I think Carolyn illustrated so well, and hormones, and all of these other things. So now we're going to go to the fascia. So you understand that that is a bioactive organ system, and that it's the new organ system. We used to think of the microbiome as being I used to think of the microbiome as being something that I began to understand, and now it's fascia, and I am delving deeper and deeper into fascia. It is very much like the gut microbiome. There are different bugs in different parts of your body. Your hands, your left and your right hand, your fingers have different biomes than each other. We have different biomes than each other. We have same, but different, right? Like twins, identical twins. So different types of fascia are in different types of location. And we'll show you this with specific functions, very different functions. The primary cell of fascia is the fibroblast. This cell turns over every 2 months. It's like the fibroblasts make a fascial web, which can be a spider web, as you see pictured here, of many fibroblasts. When you think about the web that's made up of a lot of fibroblasts, the turnover of the web as opposed to a cell is more than a year. So we've got to do a lot of work to get turnover. And we think of fascia as the place where there's thickening, fibrosis, adhesions, etc. When we have something like adhesions, it's going to take up to a year to make that turnover. That's pretty important. So nothing that we do is a one and done. Our clients, our patients have to sign on for time, because if we really want to make a difference, they have to be invested. They have to understand that this is not a one and done. This isn't what we try to mask a symptom, mask a problem like with pharmaceutical medicines. We really want to make a change. And we're going to make this change, whether it's the gut microbiome or in the fascial web, it's going to take time. When there is a signal that is given to a fibroblast, and you'll see this in some of my slides as we come up, that signal that's depicted by the fibroblast occurs within a 12-minute window. And the effect of what that fibroblast experiences in 12 minutes is going to last 3 days. A fibroblast cannot take another signal for the next 3 days. It's like that all or none potential, action potential in physiology that anybody who's a clinician understands. Very, very important. Fascia needs to move. Couch potatoes get fibrotic fascia. The signal within 12 minutes is done. It's going to last for 3 days, and that's really important. So the longer they're sitting and the less they can move, that's a problem. I have a sister. She's not well. She's had multiple issues throughout her life, beginning from 1 year old or younger. And she recently called me and said that she's been sick. She lives in another state. We don't have New Hampshire on here, but she lives in New Hampshire. She had been sick since February, and she was at her physicians in the clinic system, since February, doing tons of antibiotics, tons of steroids, prednisone, etc. And she's been in the hospital, and she says they think I have pulmonary fibrosis. Well, that's a big deal. She can't move. She's getting fibrotic. That's a big deal. What do you know about the fascia? It needs to move. Is there fascia in the lung? Yes, there is fascia everywhere in the body. She needs to move. So she said, I haven't been able to leave my house. I've been on max doses of steroids. I've already finished antibiotics over and over again. I can't leave my house. What am I going to do? And so she said, also, I have to get to CVS. This is no joke. I am not joking, but it's going to sound tongue-in-cheek, sarcastic. I have to get to CVS because CVS has called me to come and get my 4th dose of COVID vaccine. I'm like, That is insane. They know nothing about how sick you are. You do not take a vaccine when you can't breathe. Okay. So let's just stop this conversation right here. I will send you things. You have to promise me that you will take them. And that once I send you these things and you feel better, you need to move. You need to get up and get out and do not go to CVS and do not get a vaccine until we know you're better. This was just about 2 weeks ago, maybe 3 weeks ago, something in middle of October. So I sent her some things. She started to take them, some peptides. Within 5 days, she was pushing her granddaughter up a hill in a carriage. So it's insanity that she's been sick and on steroids. And I told her, you have to stop the steroids because I can't give you things that signal the medicinal signaling molecules that are going to signal your immune system when you shut off your immune system. Steroids have to go. That's it. It's really hard to signal an immune system for 3 months after taking a steroid. So I had no expectation that she would have any benefit, and she's still doing better. I mean, that blows my mind. I understand physiology. I understand aberrant physiology. So I understand what I can give her that may or may not work. I just don't know the timing of when it will work. But how lucky is she that at her age of 65, 66, that she was able to get benefit and begin to become anti-inflamed, anti-fibrotic. The immune system is regulated and now she can breathe, right? So very big deal. Fascia needs to move. Fascia, the signals for fascia are mechanical force. You could fall and have, something hit you. The pH of the tissue, we need to be pH balanced. Is the immune system dysregulated at baseline? And at baseline, it's going to be dysregulated in everybody. And the people who got sick from COVID, the number one risk factor was obesity. And so what does that tell us? Their immune system is dysregulated. They are inflamed. And I'm sure that also hormones are off, like insulin, like cortisol, like DHEA, all the hormones that you understand. So these are signals to fascia, and fascia will become fibrotic. It will become more like a swamp than like Niagara Falls, and it will not be functioning well. So here we're looking at a fascial body catsuit on the left. And basically that catsuit, that aponeuroses is the outermost layer of fascia, but there's multiple layers of fascia. It's the structure that allows movement in all dimensions of space, all dimensions, right, of space. It's composed of the same fractal arrangement as all other structures in nature. So it's not unusual. That's why bugs might like to live in the fascia, right? Because all of these fractals are things that any living thing is familiar with. Fascia is a complex arrangement of tissue that is stable and always in search of equilibrium. It has a remarkable ability to adapt to change. If the fascial network gets messed up, like I described in my sister, we can restore it. It wants equilibrium. The pH has to be good. The immune system has to be restored. Hydration needs to happen. Oils need to be present, etc. So when I think of fascia, I think of meridians, just like we do in acupuncture, because they're very, very similar. Fascia consists of membranes and ligaments, both superficial and deep. On the left, you see superficial. On the right, you see deep. You see the fascia intercalating around every myofibril. So this is the fascia, the epi, the peri, and the endomesial fascia. The epicardium that surrounds the heart is fascia. The epicardium secretes small molecules like thymosin beta-4 when there's an injury for healing. So it's very important that we understand how much fascia is a part of our body and how it intercalates like saran wrap in and around every single tissue. So fascia allows for glide. So there are 2 fibrous layers, and they're able to glide smoothly due to low viscosity within the extracellular matrix, within the fascia, between the loose connective tissues. And this permits, as you see on the left in A, the fascia to transmit forces independently, but also in different directions. Fascia is amazing that it can transmit in different directions. If we densify the loose connective tissue, as is represented in B on the right, where you see the red flash of an injury that could be mechanical, pH, infection, or anything else. The gliding ability between the two loose connective tissue layers results in an intense mechanical stress. There's densification, and we cannot move as readily. Okay, very important to understand. We want to treat that. That is about where we get pain. Pain can happen there. So during development, week 2 to 3 of development, we're a one cell layer blastula. And that's where the somites or the cells or the stem cells arise for specialization and form a variety of tissue. When you look at that pink, I'm not going to touch the cursor, but I want you to look to the right, and I want you to look at that layer of light pink on the outermost that goes in and around the ectoderm, in and around the mesoderm. And what that represents is fascia. And that's why fascia is intercalating. So this exists, the mesoderm is folded and refolded and folded and refolded in and around every myofibril during gastrulation. So if you look in the center, you can see the notochord, and that's where the spinal cord goes, and all those little pearls that you see around the reticular fibers are the white lines in the very center. All those pearls are your stem cells. So the stem cells lie within the fascia, and they're waiting for signals from small molecules, whether it's a hormone, whether it's a peptide like an insulin, thymosin beta. They're waiting for those signals to develop. So very important, the MSCs, the mesenchymal stem cells, are sitting there ready to be awakened by the signaling milieu of the extracellular matrix or the extracellular tissue. You guys with me so far? Okay, great. So it's the fascial catsuit that allows that movement in all dimensions of space. And here you can see the catsuit's at one layer on the outermost superficial fascia, but you see deep layers of fascia that are surrounding every single myofibril. And on the far right, what you see is the extracellular matrix. And we're going to go a little bit more into the extracellular matrix. So because of this fascia, a very well-known clinician in this field who treats clients, basically David Sondak, has multiple books out. You are the most elaborate piece of origami ever because of the fascia. So the fascia exists in spiral lines. So you saw that catsuit, the aponeurosis, but here we can see that the fascia loops around the body in two opposing helices, front and back, left and right, joining each side of the body from left to right and from right to left. From the upper back to the opposite shoulder. And you can see that we move in spirals. So when you have shoulder pain, an injury in your shoulder on the upper right, you can also have pain in your lower left hip. Pain is never where you think it's going to be. You have to understand the fascia if you're going to treat pain. Okay. Because if you have a right shoulder problem, it could be referred from the left hip. If you have a back problem, it can be referred from the anterior portion, and I'll show you that in one of the slides coming up. So every action has a reaction, and that is the concept of biotensegrity, where you can have a right shoulder injury, but a left hip pain, or you could have a left hip injury with a right shoulder pain. So don't go directly to the source of the pain in order to treat it. I never do that. So we have classical anatomy, we throw away the fascia, we have fascial anatomy. And what you can see here on the left, as you move from left to right, is you can see the interconnection of the fascia. If you were to dissect, and I've gone and done dissections this summer, if you were to dissect from the skull all the way to the tip of the toe, you will have one piece of adjoining tissue. So something that's occurring in the brain directly connects to the toe. The toe will affect other parts of the body. So you see the toe at the bottom of this screen in the middle, and it's connecting right to the top of the head. And that's critical. So when people tense up, or they change their posture, it's going to affect their neck. It's going to affect their back. And I have a whole slide deck on that I'm happy to present another time. You can see the tongue on the far right, and you can see the toes on the bottom there. There is a connection. You can see the diaphragm, the respiratory diaphragm is going to be impacted by things that are happening in another part of the body. And if that diaphragm can't move, can't open and close and open and close, you're not going to oxygenate, and it's going to be affected by pain in any part of the body. The breathing will become more shallow. the oxygen will become less, the CO2 will build up, and you will have other problems from more acidity, and pH will change. Very important. This is just a picture of a gluteus maximus, a butt and a leg, an outer leg, showing you and driving home the point that you may have pain in the sciatic and you're thinking it's in the nerve. It's actually an inflammatory process that is absolutely going to affect everything: the gluteus muscle, the tensor fascia lata, and the iliotibial band, which is just like, it looks like the catsuit of the fascia. So you can't just treat the IT band when someone has tightness and tautness there. You've got to treat the TFL, the tensor fascia lata. You've got to treat all of the muscles around there. And if you want sciatica to resolve sciatic pain, you also have to treat all of those areas. Otherwise, it will return. So researchers, this is another example of fascia and anatomy. On the left, you're seeing a lower leg compartment. You're seeing the bone on the upper left, that white structure with the crosshairs. And then all of the other white pieces are the bigger, epimysium, which are the outer laying of the fascia of the muscle. We then will have the perimysium around the muscle and the endomysium within the muscle. What I really like on the right side of this screen is that you can see in the back, in the distal, you see the vertebra, and you see the muscle, the paraspinal muscles with the fascia surrounding it. And you also see in the front of this, the rectus abdominis, and you see the fascia surrounding the rectus abdominis. So basically, back pain can come from anywhere in this and at any level. So researchers, show that failed back surgery occurs in anywhere between 10%, that's quite low, we all know, to 40 or 50% of lumbar laminectomy surgeries with or without spinal fusion. And, other studies show that if 36% of people who undergo a discectomy for a lumbar herniated disc saw their leg and back pain return very quickly postoperatively. So it is not just the herniation of the disc, it's the inflammatory milieu that it's being set up that travels through the fascia. It could be coming from the front, the anterior, and going back and posteriorly, or it can be coming posteriorly and causing abdominal problems anteriorly, pain, discomfort, etc. So we've got to be thinking a little bit, we think local, but then think global, especially if you want a good result and a sustainable result. So now we're looking at nerves, and here we're looking at the cross-section of a typical spinal nerve that runs along the spine in the posterior portion. And basically, you can see that every part of the nerve fiber is surrounded by fascia. Epineurium, epicardium, epimysium, endoneurium, endomysium, endocardium. So all of this is all fascia, and that is where the action is happening. So it's very important to understand this. There's a little bit of blood vessel there. The blood vessel is also made of fascia. It's all consistent. And here's a cross-section basically looking at a dense network of nerve fibers. This is the thoracolumbar fascia. And basically what I think about when I look at this is I think of this as looking at the fascia. It can be superficial, it can be dense. And within that dense network of the fascia, we're seeing the nerves, and those little lines that you're seeing are the nerve fibers that are getting annoyed and giving you the sensation of either burning, of pain. If it's superficial fascia that's feeling it, there's a superficial and a deep layer. The superficial fascia is going to give you the burning. And it's going to be very cutaneous, very superficial. You're going to be able to touch very gently and potentially calm it down or activate it. But this is in the superficial layer. When it's in the deep layer, it's that, when it's in the nerves in the deep fascial layer are being bathed in acidic milieu, toxic milieu that hasn't been detoxed, no nutrient milieu. That's the milieu that's going to give you the deep, deep pain. And that's important to understand. So when we think about a typical nerve of a muscle has many nerves. There are 3 times as many sensory neurons as motor neurons. You are going to get a signal, stop, do not move, right? So sensory neurons are abundant. They're 45% compared to 17% or 15% of motor neurons. And the vasomotor neurons are also pretty significant at 45%. It's really important to understand those vasomotor involuntary sympathetic neurons are there, and then the sensory neurons are going to give you the signals of what needs to happen. And generally speaking, if we were to go back to one of the first slides, mechanical sensation, no detoxification, oxidative stress, pH that's acidic, et cetera, et cetera. We'll look more at that. So the largest sensory organ, knowing what we know about this, the fascia, is the fascia, not the skin, right? So whatever somebody's feeling superficially is in the superficial fascia that's contiguous with the skin. Again, this is showing the free nerve endings that are up, right? And when there's shearing forces, when there's compression, when there's tension, when there's toxicity in the superficial layer or the deep layer, the superficial layer, the little bubbles where you see the top ends of the nerves, the deeper layer is down at the very bottom. So that's the deep fascia versus the sensory fascia. But these free neurons, nerve endings account for 80% of all sensory nerve fibers. They give constant feedback about mechanical changes of tension, stress, temperature, sensations, the air, and they help to regulate heart rate, blood pressure. They're really, really important to understand. When you're treating with laser, when you're treating with peptides, when you're treating with hormones, it's in these layers, whether it's insulin, estrogen, progesterone, testosterone, it's within these layers that there's signaling that's happening. And that's really important. Hyperactivated free nerve endings, as you see here, are thought to be the source of chronic myofascial pain syndrome or other pain. No, it doesn't really matter. So we're looking at fascia and pain, injury, and cellular tissue and healing. Elasticity in that tissue, a balance of elasticity. Obviously, we have ED, Ehlers-Danlos syndrome. We don't want to be over elastic. We don't want to be under elastic. We don't want to be pumped with muscles that are so tight that the tissue can't move. That's compressing. So we need to think about elasticity. And elasticity will come from, working with other clinicians within our group, within the functional medicine groups, in order to have them help with whatever work they do. Somebody earlier mentioned Eli Thompson, who's a clinician who does a lot of fascial elasticity work. He's outstanding. He's in Brookline. And I think that, Tom Brady understands this. He still looks like he has a dad bod, even when he's in his best shape, but he has elasticity, he has strength, he has tensile strength, and he has optimized pH and tissue milieu. And so whatever happens, and knowing Tom, whatever happens in his hand is going to affect his throwing shoulder. Whatever happens in his deltoid is going to affect his throwing shoulder. And so the treatment that we can do as quickly as possible to heal an injury, a wound, superficial or deep, regardless of where it is, whether it's his knee or his shoulder, is going to benefit him. It doesn't really matter if we do it. It would be best to do it initially, but it's also okay if we do it later. So this is some research. The fascial system is a 3-dimensional continuum everywhere of various connective tissue, because it's all has different functions that permeates the body. Injuries to the fascial system has a potential role in the development and perpetuation of any musculoskeletal disorders, low back pain, myofascial pain syndrome, myalgic fasciitis with vaccines, etc. So understanding fascial adaptation to mechanical and biochemical conditions, as we know we can measure from Vibrant, is important for injury prevention. The fascial system that we call the fascia net involves every single level of the body, from the micromolecular and cellular to the macro. Important to understand. This is a little complicated slide. It's not too complicated. I'm sure you can understand it. It's acute, subacute, and chronic phase of injury. It can be any kind of injury. It could be liver. It could be joint. It could be any kind of injury. There's an injury that happens in the acute phase. What happens is you get pain, and that immediately changes the tone of the tissue, the muscle tone of the tissue. There's reduced muscle tone. It basically tightens up. There's an alteration in the function around that tissue. You get adipose deposition, which is a problem because we want to have as much muscle mass as we can. Because when we deposit adipose tissue in time, in 3 to 4 weeks, we're getting an inflammatory response in those adipocytes. The macrophages are changing from M2 to M1, the pro-inflammatory macrophages. And then we're going to get within that adipose tissue an increased expression of inflammatory cytokines like TNF and IL-1 beta. And that's important to remember. So we can still change this, but Earlier is better, but never too late. Remember that. Now, in the muscle function, we're going to get a transition of muscle fibers to fibers that can go from ever. They're going to change from that endurance-like fibers, slow fibers, to fast fibers, to fatigue the muscle much more quickly, of course, because if we don't fatigue the muscle, we continue to propagate the injury. So increased muscle fatigability will happen. And in the muscle fiber as well, you'll get inflammatory macrophages or pro-inflammatory chemicals. And then you'll get a sensitization of the nociceptors, and you'll continue that pain spiral as long as you can. Ultimately, you'll get fibrosis, and fibrosis is a big problem. Thymosin beta-4 is the best antifibrotic chemical I know, signaling agent I know. And you'll get increased collagen expression, but it'll be the wrong kind of collagen. It'll be collagen that's fibrotic as opposed to elastic. Elastin, relaxin, and all of these other hormones that we now understand will be reduced, and that's a problem. So you get compromised tissue dynamics, force generation. You won't be able to load the muscle. You'll get atrophy and fatty infiltration, and then we have a massive problem, right? So we want to definitely understand that. So thinking about the fascia, we're thinking about it as your pizza dough. Some people like it a little thick. Some people like it very thin, but you got to roll it out. You've got to treat it. You've got to take care of it. You got to put a little oil on it. You've got to do what you need to get that fascia to be very elastic. What's important? Hydration. I can't tell you how many people have dehydration in my practice. Stage 3 kidney. Absolutely, positively, it's the number one thing I see, along with CO2 changes and too much CO2, not breathing deeply, not oxygenating, and a lot of acid. So hydration, pH balance, collagen with vitamin C, and I'm sure upstairs they sell pH strips, lecithin, phosphatidylcholine. Those will maintain the integrity of the cells. Rolfing, rolling, acupuncture, structural integration therapy, manual therapy, just touching your patients makes a massive difference. Photobiomodulation therapy, all of these things can change, and peptides and hormones can change the fascia. So here is a cell, and you're seeing the nucleus of the cell on the right, far right, and then you're seeing the cytoplasm of the cell to the left of that, and you're seeing the extracellular matrix. The extracellular matrix is the fascia. That's where the ground substance happens. And the extracellular matrix may also be called the interstitium. It may be called the extracellular fluid. Whatever you call it, understand that it's fascia. It's the ground matrix of fascia. It will contain collagen, elastin, relaxin, water, mechanoreceptors. Right here, you see these integrins right at the border next to collagen where the red arrow is. And the integrins are mechanoreceptors. And basically, when somebody touches you, just like when we have a premature baby and we let them lie on our chest, the naked chest, so that they get sensation, effectively what we're doing is we're propagating information to the nucleus of the cell to turn on the right genes, that everything is good. So these mechanoreceptors are very, very important. We cannot survive without smelling, seeing. No, we can survive without smelling. We have with COVID, seeing, tasting, hearing, but we cannot survive without touch. And the information that it relays from the integrins and this extracellular matrix right to the nucleus, activating appropriate genes. Oops, backwards. So the exposome, we are a sum of everything we've been exposed to from the day that we were conceived. And you even know through MTHFR work that even from what our mother had originally, we are a sum of all of our exposures throughout our entire life. We can never get rid of them. The body keeps the score. So the CDC in prevention has shown that genetics only accounts for about 10% of diseases, but the remaining causes that activate that nucleus to transcribe things and misguide proteins is mostly from epigenetics and exposures. And that can be anything. So factors affecting an individual's exposome include the genetics in a small way, lifestyle, occupation, exposures, living environment, food, sleep, stress, the way we handle stress, whether we connect our nutrient deficiencies, etc. So research study looking at the dynamic human environment. In this study in 2019, they took individuals from over 66 different geographical locations, and they studied them for 2.5 years. And what they found was that the participants were exposed to a whole host of environmental factors, chemical, microbial, but that depending upon the area, the geographical location that you lived in, you had different outcomes. So that further strengthened the notion of how important the exposome is, and that even with identical twins, it's highly diverse and highly dynamic and very dependent upon many of these location, lifestyles, seasons, etc. So you can look at this a little bit later. You know what the different examples of external terrain are in the exposome. The things I want to point out are the adjuvants of aluminum that carry vaccines, squalene, graphene that carry vaccines and medications. Dr. Yehuda Schoenfeld looked at Asia syndrome, autoimmune syndrome induced by adjuvants. And what he found was that in the Gulf War veterans who all were prepared to go to the Gulf, but only some went, anybody, it didn't matter whether you went to the Gulf and got exposures, because we all believed that you had to go to the Gulf to have the exposure to have Gulf War syndrome. Anybody who got the vaccine, even those who didn't go, could potentially have gotten Gulf War syndrome. And that's pretty important. And he, determined, he's the father of immunology. He's written the big, massive textbook that it was the adjuvants that were causing this symptom in the setting of whatever the environmental exposome was of the patient. Very important. There's also the genome, methylation, the genes, the microbiome, dehydration, the fascial health, cellular health, all of immune system regulation, etc., that influences it. So there's a personal exposome that is different from identical twin to identical twin. There's an external exposome that's different from between identical twins, and there's biological responses that will be different regardless of having 99.99999% of the same genes. So, and we know that the environment is important because we know Morgan Spurlock from Super Size Me, who in 30 days went from 11% body fat to 18% body fat. That's pretty substantial. Imagine what that's like over your lifetime when you're not moving and you don't understand diet. And it blows me away that I talk to my patients, they're relatively health oriented in order to come see me. They don't know what to eat. They don't know what to eat. They need to be told what is healthy. They need nutrition consults. They need to see people who understand food, not somebody who's an RD who learned the old method. They need somebody who is current and up to speed. And the fatty liver, just all of the labs that were so out of whack in 30 days was remarkable. But the national average of percent body fat is already 22% in men and 30% in women. This has to change. The currency of aging is having healthy muscles and having healthy fascia. So that's what you're trying to do. That's what the website is trying to do. And I applaud and want to be part of it. So we know that we have different immune system identities, and it's based upon the accumulation of the cells in the immune system that have mutational injury and epigenetic changes, senescent cells. You've all heard of senescence, cellular senescence. So we can go into that at another time. But these factors that we have an exposure to influence the inflammatory state of the individual. So we've got to think about nutrients first: hydrate, move, alkalinize, balance, restore nutrients, and then get to hormones. Adjuvants, the 3 top symptoms related to having an adjuvant exposure from a vaccine are pains, whether they're in the muscles or the joints, and fatigue. Omnipresent, okay. The most common Asia diagnosis is undefined connective tissue disorder. We don't even name it. We should at least name it that, because then we have an undefined and we can put it in a category. But generally speaking, we just say, oh, you have a myofascial pain syndrome, but we haven't done much testing. So we really do need to test. This is Dr. Schoenfeld. He talks about autoimmune diseases like a kaleidoscope. What we try to do is we try to treat with a monoclonal antibody. We use a lot of MABs, and the MABs just they polarize you in another direction, and you get a dark side, and they are not sustainable. You can use them temporarily, but don't kid yourself that they are sustainable. Asia syndrome is a massive pain syndrome, which is why I talk about it. A lot of it can be related to various agents that are in vaccines, can be related to infectious agents that are in vaccines, can be related to silicone. Silicone is used in so many types of implants. It's a really big issue. Silicone breast implants will cause a myofascial pain syndrome, and does in the vast majority of patients. If they were to explant the silicone breast implants, the myofascial pain syndrome can improve. It cannot improve while it's in there. So that's one of the questions that we should be sure to ask our patients. And people who have genetic predispositions through their HLA, DRB1, DRB4, they are way more predisposed. I would want to know that before I'd get down the path of getting a silicone breast implant, if I would even consider that, right? So, and it can trigger autoinflammatory and autoimmune conditions. And again, this is the Gulf War syndrome. We talked about that. Post-vaccination syndrome. There's a new name. I have a patient whose doctor did tell him that he has this pain syndrome and atrophy of his entire deltoid, a very fit person, post-COVID vaccine. I can't remember the name of it. I apologize because my brain moves so fast and I just know it's there. But anyway, silicanosis, adjuvant silicone, we're all familiar with that. Sick building syndrome. This is a paper by Dr. Schoenfeld, the beginning. He started in 2011 looking at Asia syndrome, and I just took out all those early papers and put on one of the latest 2017 papers. But he's very involved in that. He's an immunologist. And this is when the extracellular matrix is bathed in a swamp, this is what it looks like. Nobody wants this, but we have to be thinking, what's in that swamp surrounding these cells? Stem cells will never activate for healing. Those pericytes that live that I showed you on the reticular fibers, they will never activate in this. That's it. So a lot of times there are people who do a lot of type of therapies with exosome stem cells, etc., even peptides, and they're putting it in this. What's the point? There is no point whatsoever of putting something that's amazing into this waste product. It's the solution to pollution is dilution, nutrients, lifestyle, movement, balancing pH, the same things that we've talked about. So every tissue is the same. We talked about the plasma that you can measure in Vibrant. We talked about the intracellular level, and we talked about white blood cells, etc. But the reality is everything is a reflection of another. So when you look at the plasma here, the blood, that should be diffusing. There should be a gradient so that there should be diffusion of things into the extracellular matrix or extracellular fluid. It's the same, the fascia and the ground substance, and then that should be able to become intracellular. But you don't know what's gumming it up in the extracellular tissue. You don't know if you've got plaquing in the plasma, in the blood vessels. So you've got to understand these things in order to understand what you can provide for the cell. Because even if we don't understand it and we try to get glutathione into the cell, how are we going to do that? You've got to really be cognizant of how you're going to get glutathione into that cell if the extracellular interstitial fluid is gummed up, as you saw in the slide before. So here's the fascia of the extracellular tissue, extracellular matrix. The extracellular matrix is, if you look down the bottom, is made of ground substance. That's that gooey stuff that we saw. It's fibers, mostly collagen, some elastin, there's some relaxin, etc. And then you see the cells in the upper top. There are not many cells there, but the cells are really important. Those fibroblasts are really important. We now know that there are fasciocytes there as well. That has been discovered recently by Dr. Stecco in Padua, Italy. There are mast cells. There are pericytes, which are the stem cells. There are nerves, there are vessels, but most importantly, that ground substance at the bottom, we've got to keep that clean so that we're secreting the right kind of collagen, the optimal amount of elastin. We've got to basically, manage that. And it's really thought that that immune dysregulation and then free radicals, etc., is what's causing the buildup here. So again, all of these fluids are a reflection of each other. And so it's really important that we understand that the intracellular fluid is a reflection of the other tissue. The extracellular matrix governs cell functions. It produces, like I told you, thymosin beta-4 and a cocktail of other signaling molecules and chemicals that are exuding as when the fascial tissue is injured. The cells use the matrix to impart strength, to shape to tissues like the bone and the brain. Previously, we never paid any attention to it, but it's very important to do that now. The extracellular matrix guides the stem cells to repair damage, wounds, reform blood vessels, angiogenesis that are damaged by any cardiovascular or stroke, etc., and to alter the cellular responses to chemotherapy. The extracellular matrix serves as a reservoir of these signaling molecules, and it's a highway. They don't just stay local. They may be local, but they're acting globally in autocrine and paracrine and juxtacrine mechanisms. So again, this is the extracellular matrix on the left. These are the nerves that are within that matrix. We need a clean environment in order to keep that all functioning well and to reduce pain and to reduce dysfunction and disease, chronic disease. And here you see it all aligned, fascia, fascia, fascia. Every one of these is fascia. They look a little different because different parts of the body have different function and have different compositions of different types of collagens, etc., in the fascia. And that's important to understand. So we can end up with degeneration because we let that stay swampy, or we can be well as we age and improve senescence, improve autophagy, improve all of these things within the fascia by balancing the things. This is Carla Stecco, Dr. Stecco. She's a professor of anatomy. She's also an orthopedic surgeon in Padua, Italy. And she, in her anatomy role, she dissects to understand the fascia because she wants to understand the fascia in orthopedics and in life. And so she's working, night and day trying to understand this. She founded the new cell, the fasciocyte, that releases that hyaluronic acid that allows for the glide in all directions, right? Hyaluronin needs to be of a particular viscosity. In that swamp, the viscosity is way off. In Niagara Falls, the viscosity is great and it's flowing, right? So we've got to understand that. So in the fascia, we have fasciocytes, we have fibroblasts, we have fibrillin that increases elasticity. We have elastin that also allows for resilience and recoil. We have collagen 1, and collagen 1 has more strength than the Zakim Bridge in Boston. Okay, it can impart more strength. Collagen 3 is for repair, for the toughness of the cartilage and the joints and the tissue. This is pathology, electron microscopy. The darker portion on the bottom left is the muscle. It's MF, myofibril. There are Z lines, there are costamers, there's basilar laminar layer, but the dark is the cell, and the white just outside of that, where it says CF and RL, the reticular lamina, that is basically the extracellular matrix, that is the fascia. And all of that needs to be clean. You can see how intimate that connection is. You cannot separate that from the cell. That's why it has to be cleaned up. And you can clean it up any way you like. Medicine is an art. Pick what you're comfortable with and clean it up like that. Acid-base status, people can measure their urine. I'm not a fan of ketogenic diets. I'm not a fan of ketosis because I think ketosis creates acidity. I don't think, I know ketosis creates acidity. You can be on the edge of it, but good luck. That's a really fine balance to be. But I'm not a fan of that because I know that it shifts electrolytes, particularly potassium, and it's very acidic. So the whole body benefits when acid and pH levels are balanced, and fascia thrives when it's more pH balanced. These are some studies that basically demonstrate the same thing. Every athlete who's a good athlete and is competing at a higher level, they measure lactate levels. They know what their lactate levels are. Lactate lowers pH. It makes you acidic. Lactate needs oxygen. You will not make as many ATP as you should, 36 ATP per cycle of the citric acid cycle, a Krebs cycle. You'll make 8 or you'll make something lower. The cell will be in cell danger response. So lactate is important. I always measure lactate in every patient, not just in athletes. And we know what happens, and you can read this here. And we know that acid burns because when we do a local infiltration with lidocaine, we activate and harm the peripheral nerves. So phosphatidylcholine, there is tremendous evidence. It's one of the longevity agents. It's very, very important for the cell membrane to keep the fluidity, to protect the cell. So I think it's very, very important to understand that. Temperature has an effect. If we go cold, we reduce the viscoelasticity of the hyaluronin and it can't move. So exercising in the cold, if it's Christmas and the Pats are playing, they're not going to play as well unless they've warmed up appropriately, right? Because the hyaluronin is not going to allow for the glide and for this, and injuries are more likely to happen. If it's too hot, that's not good. But if it's just right, you get your tissue. I exercise in a heated bubble. So I go in the heated bubble and I warm up a little bit in the heated bubble, and all of my exercise is done in the bubble. So temperature has a very important effect on hyaluronin, glide, and injury and pain. So fascia likes heat more than cold. It doesn't love 100 degrees, but If immobility, not moving, will also reduce lubrication and gliding and alter muscle structure and function and create inflammation. Fascia and temperature studies, you've seen this. So let's go to treatments, the regenerative potential. I love using multiple modalities. There is no way I would ever treat a patient unless I prime the pump. I'm thinking of the fascia with nutrients, with hydration, with oils, with phosphatidylcholine, making sure they're oxygenating and they understand breathing and the respiratory diaphragm. You might use photobiomodulation. You might use shockwave therapy. You might use oxygen while exercising. Anything, everything. The more we put together, the better. So if we think and we take 6 bricks and we combine them in different ways, this is why medicine is an art. You get 915,103,765 combinations. Just think if you add another block to this. So you get exponentially more opportunities for healing. So if you're using lifestyle, nutrients, hormones, peptides, ozone, oxygen, laser, shockwave therapy, injections, you're going to get much more, like you're going to have healing be much more likely. So you can create using those combinations, whatever you like. It can be the athlete, it can be the everyday warrior. I love peptides. I also love hormones. I love thymosin peptides because they are 100% safe. Thymosin alpha-1 is approved off-label here for use in viral loads. It's been used all over the world. I just came from a thymosin group and learned that in China, in Italy, they did a study after all of those deaths that they had using thymosin alpha, and they saw tremendous benefit in people who were very sick with thymosins. That was Dr. Goldstein. He is not the founding father, but he took over from Dr. White in the early 60s, 1960s, and started Albert Einstein College of Medicine to study the role of thymus. He has a partner in Italy, in Rome, Italy, Enrico Garacci. They're both in their late 80s, and they both are the grandfathers of thymosins. And they have tons of proteges all over the world who study these and have been doing so for 75 years. There are a variety of different types of thymosins. The primary thymosin that's immunoregulatory and modulatory is thymosin alpha-1, and then thymosin beta-4 is all about actin myosin, which is in muscles, but in tubules and everything else, makes new blood vessels, heals wounds, it's anti-fibrotic, makes new neurons, et cetera, et cetera. So very anti-inflammatory, wound healing and angiogenesis. It has an ability to activate progenitor cells, which are the pericytes, the MSCs, to repair damaged tissue. And as I told you, there's a study about the epicardium during MI releasing thymosin beta-4 for healing. So promotes rapid wounding, angiogenesis. You see the slide. Not a lot of collaterals, much more healthy blood tissue, blood vessel tissue, and it's very important. It can combat sarcopenia. It can reduce pain dramatically. All the athletes know about this. They're not allowed to use it, but they all know about it. It's able to hone and re-regulate, and it can find the site of injury very easily because fascia is all connected. In those early slides, I showed you where the brain connects to the toe. Fascia just goes up and down. It doesn't have to stay in one area. Thymosin goes up and down. BPC is another extremely safe peptide. There are absolutely zero side effects reported over decades of use. So it's like the Swiss Army knife. It's only 15 amino acids. We're not allowed to use peptides that are above 40 amino acids as per the FDA since the vaccine came out. So basically it was founded because it heals the digestive tract and it's released into the bloodstream, and it's called body protection compound. It's got tremendous use in leaky gut for healing the break in the gut wall. It's got tremendous use in Crohn's, colitis, and immune dysregulation. So it was initially founded in Croatia from a sample of gastric juice. It's anti-inflammatory, All the athletes use it. It's a medicinal signaling therapy, and it works in the same way in the fascia. It's widely used in bodybuilding circles. It's widely used for pain. I use it in the mouth for tooth and dental repair, but mostly for the gum repair. It's used and has been studied extensively at the Kresge Eye Institute for corneal repair. It's now being studied along with VIP, another peptide, vasointestinal peptide, to heal a diabetic eye disease, retinopathy. It can repair bones, etc. I use it all the time. It protects the endothelium of the cell. It does everything. It's so pleiotropic. It's amazing. It improves tendon healing functionally, biomechanically, macroscopically, microscopically, immunohistochemically, and it can substantially reduce the healing, the aggravation of a wound that's healing from methylprednisolone or prednisone. So it does direct tendon to bone healing in the fascia. That tendon that's attaching to the bone is fascia. It's a certain type of fascia it's not toxic. No carrier necessary. BPC directly goes there. Here they detached an Achilles in an animal model, and basically they compared putting it in 10 micrograms per kilogram of BPC versus putting the injury in saline. And you see on the far right that there's complete healing on the far right with BPC, with significantly less healing and less functionality on the left. Type 1 works in the bone, the dentins. That's why I use it in the mouth. When people have bone breakdown, especially if they've had implants put in. It's been demonstrated to provide endothelial protection, and it works through the nitric oxide system. So we can take nitric oxide and we can use BPC to make that nitric oxide work better. It's used for inflammation. It decreases any type of inflammatory chemokine, cytokine, etc., leukotriene, all the things that Chris showed in his early slide with curcumin. It's completely safe. I use a lot of shockwave therapy. It's different from photodynamic therapy. I also like photodynamic therapy. Curcumin is an example of photodynamic therapy. The red light is an example of photodynamic therapy. Laser is an example of photodynamic therapy. This is shockwave therapy. It's been used for a long time. It's been used much more readily since the Olympics. They didn't allow us to bring a lot of type of shockwave therapies over here until from stores, which provides a lot of medical devices, until after 1996. And now we can get many different types of devices. So shock waves are very different. This is a shock wave. It has a high amplitude and then it oscillates. It's very different from ultrasound. Ultrasound is not nearly as powerful as shockwave therapy is for working on the fascia. There are different types of shockwave therapies that work on the superficial fascia, different types that work on the deep fascia, and different types that work on the bone. And these are some of them. You've got a focused applicator. Radial is for superficial. Focused is for deep fascia. And they work by, opening up and popping the different vesicles that are like exosomes in that tissue and allowing the release of growth factors. So they have an analgesic effect. They release substance P from these granules. They release a lot of different growth factors, and they can also stimulate stem cells. So they break apart scar tissue, fibrosis, just like thymosin beta-4 can do. You've seen this already before and after angiogenesis. It's really all about the right energy of the acoustic wave. It can be used in multiple ways. I have no affiliation with this. I don't make any money with any of this. Prevention, recovery. This is Hyperice. This is Theragun, etc. But the ones for the medical offices are much stronger. Injury rehab. There are many indications. The number one is plantar fasciitis or anything in the heel. It can be used anywhere in the body. Obviously, if someone has an active tumor, you don't want to pop open the tumor. Pregnancy, we don't do anything in pregnancy. If someone has steroids, corticosteroids on board, it's pretty tricky because that's shutting down the immune system. So we have to be aware of that. Just like I told my sister. You can use it in hemophilia. You can use it if someone's on an anticoagulant, if they've had a thrombosis. I have used it in all of these situations, and you just have to be careful and know what you're doing. It's not a problem. There are hundreds of scientific studies. There are hundreds of scientific lots of scientific works on PBM as well, photobiomodulation. Here's some proven results from when the extracellular shockwave has been used at reducing pain. And the red line is not reducing pain, that's in the control, and the purple line at the bottom is a pretty significant reduction in pain. Reducing scar tissue to help with natural regeneration, even if it's 3, 6 months, 12 months out. That's pretty remarkable, because all of these people who have surgeries all have scar tissue. Anyone who's had a surgery has a scar tissue. Anyone who's had an injury has a scar tissue. So it can definitely help and promote the proliferation and self-renewal of mesenchymal stem cells to accelerate healing. There are tons of studies in plantar fasciitis. There are studies in stroke rehab. This is what the device looks like. This is the radial shockwave. It's an approved therapy. It's covered by insurance. It's shown to increase days back to the field, back to movement, and remember, fascia needs movement. So anything we can do, forget about athletes, at getting somebody back to moving is better. So we're finishing up here with a couple of case studies, but we have to prime the system. We have to sleep, because that's when healing occurs. We have to hydrate. We have to do an anti-inflammatory diet. We have to have some relative fasting or caloric restriction. Not overeating is the bottom line. Movement, minimize exposures to foreign chemicals and bugs to the best of our ability. These are very important supplements for priming the system: omegas, phosphatidylcholine, quercetin, collagen, with vitamin C, because vitamin C is necessary for absorption of collagen, copper, glutathione, curcumin, turmeric, etc., polyphenols. Hormones, estrogen has been shown in both men and women to be a really key influencer of longevity. Obviously, in men, it's around 25 units, whereas in women, it's a little bit higher. And that is pretty critically important. We know that DHEA is important. We know that insulin regulation is important. We talked about growth factors. Insulin-like growth factor, which is a derivative of growth hormone, is also very important. We can use any type of the platelet-derived chemicals for healing as well. Peptides like the thymosin alpha beta, BPC, CJC, IPA, ipamorelin, those are IGF-1 growth factor inducers. AOD, which works on bones, ligaments, tendons, and is also promotes lipolysis or breaks down fats and helps with muscle. Shockwave therapy, structural integration. This is not a comprehensive list. This is just a list of things that you must think about before you add in, more advanced things like peptides or PRP or etc. Case studies. This is just a simple case study. 26-year-old male. He has a lot of other issues. He needs to move. I convinced him to get out and move. So he's out, and he tried to go out and play some soccer on a field on the Cape. And basically he injured himself and he was in significant pain. We did 2 shockwave therapies, 20 minutes. I didn't do it. My staff did it. And he was pain-free and back to playing soccer. So I'm showing you a variety of things that you could do. This is another 26-year-old male. I brought him to A4M and treated him at A4M. He's an avid athlete. He's young. He's not a phenomenal athlete. He's a smart guy. He came in November with a sustained injury to his left shoulder and right knee over a long period of time. His left shoulder, he impinged while benching. So this has been 2 years. He did physical therapy. He's really into being well and being better. And he really had not recovered his full strength. And he had some pain after exercise and a lot of soreness that prevented him from being as fit as he wanted to be. So he wanted some help. He also had a right knee injury. I had to ask him at A4M which one I was going to treat. The other one I treated when he came home for Christmas. I treated the shoulder at Christmas. I treated the right knee. And the right knee, basically, he had a partially torn MCL that was significantly earlier. And he wore a brace and he did PT and he really still could not run very, very well. So we basically injected his knee with alpha-2 macroglobulin, A2M, some other growth factors like peptides, and he regained full use. That was just after 1 injection. He's a young guy. He's a health-oriented guy. He has a Theragun at home. He has plenty of money to afford whatever he needs to do. Lucky for him. No soreness or pain. When he came back, I injected his shoulder with hyaluronan and growth factors. And again, he was back skiing, which is what he wanted to do. This is a cool guy with a cool dog and a cool outfit. But basically, he is a Division I athlete. who was on scholarship and on ROTC as well. When I knew him because his mother's a physician in another state down south, and basically he had right knee pain and post-exercise infusion for quite some time, and he had another doctor down south inject him, and it was very painful, so he wanted nothing to do with that. But basically during ROTC and during his training for track and field, he was unable to run. And he previously could run like 5 minutes, but he had too much pain and too much effusion to be able to run. And he was unable to squat and do cleans because of his knee. So in March of 2018, before I met him, he had his first surgery for a meniscal tear, creating fibrosis, right? He got some results, but then 6 months later, he had a second surgery to scrape scar tissue. In my mind, scraping scar tissue is dumb because you're going to create more scar tissue. So you scrape and you create, you scrape and you create. So you've got to do something different. It may be PPM, it may be a laser, it may be thymosin beta 4, but it's got to be different. And at school, he went to see a surgeon that his team set him up with, who wanted to perform a cadaveric tissue transplant in his thigh for his problem. You know, he didn't even have that I knew of at that time, an MRI. I hadn't seen it. So I said, look, you got nothing to lose. We can do some stem cells. We can do some peptides. We can do anything we want. You can take BPC orally. We can do all of these things. And if they don't work, they're still priming you for surgery, and you can still go get a cadaveric transplant, or you can just do a cadaveric transplant and you could find out that you're still the same, or maybe you're worse. I don't think he's going to be much better with that. But at any rate, he decided to opt for coming here, and there were some studies that I show you there. So he came and we did some MSCs, some peptides. He took some oral peptides home. He's very health oriented. He eats everything. He counts, he watches. He's had NutriValves done. His mother's a functional medicine physician. So he is all over. He wants to be in the Olympics, and he wants to be at the top of the Department of Defense. So this kid is serious. So I didn't really need to prime a lot of other things, right? Because he had already been primed. 6 months post inject. I'm not going to do the interview. It's like 7 minutes, but basically he was inspired to be even healthier. I don't know what that means, but he was really watching his food and his sleep and everything else. He was skeptical when we did this if it would work, but 6 months later, almost September here, and I saw him in December, he basically was fully healed. He could run 5-minute miles. I basically begged him to not do that because I thought, you know, these things heal you over time. And I don't, you know, you don't need to be injured. You need to build, and you need to, you know, stay within a reasonable amount, particularly while you're healing, because it's 6 to 12 months to get full healing from the treatments that we did with him. He was pretty enthusiastic, but I recommended that he get one more treatment in December. So he came again for one more treatment, flew in, flew out, and he's still doing great. I mean, I just did that prophylactically. You don't need to hear this. It's the same thing. It's the same kind of stuff. So you've seen it all. TB500. I loved thymosin beta 500, shockwave, focus shockwave, EMTT as a magnetic therapy, yada, yada. So, you know, this is a woman who obviously needs hormonal support because she is 56 years old. So she does have hormonal support. I'm showing this slide because I do hormones in every patient. I measure insulin, I measure estrogen, cortisol, D, I measure everything, and I try to balance it. I just don't talk that much about it. But she is doing hormones. She is doing DHEA. She's got vitamin D, whatever she needed based on her lab work. And that's what we were doing. So the most important thing is really knowing the use of patient-specific, not IV, oral or IV nutrient therapies, diet modifications, sleep adjustments, detoxification, stress reduction. All of these things are really important. And we really shouldn't go to advanced therapies unless we know that the patient's willing to do these things, because they are absolutely essential, which is what Vibrant measures and what Chris helps you to treat. And all you know many other people in the industry that are helping. I'm not going to go through these because you've already seen them and I don't need to do them. Let me see what else I have. I love the elemental diet because I love having elements that are going to be readily absorbed. Thank you very much. Whirlwind.
Yeah, sorry, questions here. Yeah, you might go up, you get down. Yeah. Do you have any questions here? No questions yet.
Thank you so much for listening. It was a lot. It was heavy. But it's the beginning of understanding some of these issues and why you do what you do.
That was excellent. Thank you.
I'm gonna reach out to her.
I want to open it up to the other groups so they can speak.
Yeah.
Yeah, if anybody has any questions, please unmute and fire away.
Am I on speaker? Can people hear me? Okay, I just want to tell you that I'm not promoting anything. I don't get paid, but BPC with PEA is a phenomenal pain product. You know, you don't have to do sub-Q, you don't have to do injections. There's a code through Healthgevity. Oh, I can't see it. There's a code through Healthgevity, Boston 15. I think it's an amazing product. I definitely think you should all try it. This is for Chris.
How long do people stand?
So I was going to ask about the shockwave therapy. Did you get the machine?
Yes, I have all the machines. I went to stores in Switzerland and understood the nature of the machines, bought the machines I've been using. The machines are they are pretty complicated things that you can do. And I'm a physiologist and an exercise science person, but I don't do the treatments. My clinical assistants do the treatments and they love doing these treatments because they get fantastic results.
Yeah, we're looking at the Apex laser, and then I was looking at the shock. I don't know if you know Aspen or Charles Vollwaller or Mark Hamlin, Michael Hamlin.
Yeah, I know Mike from Mass General. Yeah.
Right.
Mhm.
So the Apex, their new Apex 3 and 4, it's 30 watts, and we had, tremendous results.
Mhm.
Pulmonary. So Leslie can talk to you about our laser program. So I was just looking at the shockwave. So Leslie has taken our energy program with FSM and pulsed electromagnetic field. And I just think the future of medicine is all wavelengths and
FSM is
repair.
wonderful, but I think for PEMF, I compared PEMF to EMTT, which is a shockwave-like therapy from stores. And I think EMTT is more advanced, just FYI.
Well, maybe our next meeting or two, we'll do an energy medicine and we'll look at our therapies and outcomes, and hopefully this was great. Sorry, I'm actually on a PEMF call from Switzerland. So I'm on 2 calls tonight. So I just want to thank you so much. And we look forward to everyone becoming members and helping us support the initiative that so many people have held together over our entire last, it seems like, I don't know, when did we go? 10 years ago, it feels like. But we finally have the website, we have a membership, we have a portal, and we can track our information as it comes in. So thank you, everyone, tonight, and thank you so much.
Thank you for inviting me. Thank you for listening. And there's just one question: Yin yoga as a support for fascia recovery, 100%. I mean, using, as I showed you, those 6 blocks in multiple modalities is really, really important, because the more modalities you use, and whatever you like, that's what you use. You don't have to use every modality, you just have to use a few. Thank you so much. Appreciate you. And I'm excited for the future. For you.
We just do a lot. We're going to bring up one slide to give you a preview of coming attractions. And again, we want to thank Dr. Kathleen O'Neill Smith for a fabulous presentation. And luckily we did record it, because it's the kind of information dense session that you just learn more every time you listen to it again. So it will be posted for you to re-listen to. So you can just really keep getting deeper and deeper layers of understanding We just want to give you a preview of coming attractions. I'm hoping
Just
you
give me
can
one
see my slide in 1 minute.
Shut hers off, and then we'll be able to. Just give it- Just give me 1 second. We'll get that up there. Let me grab this. Okay, that should be on. Nope. Talk about it while we're.
Yeah, so we're constantly challenged to make sure that everyone can see what we're seeing here, but I would like to let everybody know that our next Greater Boston Functional Medicine meeting, our winter meeting, will be on biological dentistry. And it's going to be held this time in Simsbury, Connecticut, with, again, all the other regions, Maine, Rhode Island, Boston, tuning in through Zoom. But we chose to begin having some of our presentations and meetings at different sites so we can bring in a wider array of speakers without having to have them travel. And we're very fortunate in January to have Dr. Yerv May be speaking, both a doctor of medical dentistry and a naturopathic doctor. And he's really doing amazing work out in Connecticut. He's going to talk to us about biological dentistry, everything from root canal alternatives to using biocompatible materials for implants, to his use of laser and ozone in his office, really giving you all the tools to share with your patients in terms of helping them get the best holistic dental care possible. So we hope that you will join us. You'll see a Eventbrite, and you'll hear it advertised through our sponsors, Integrated Therapeutics, Vibrant America, Orthomolecular, Zymogen, and Johnson Compounding. And we hope that you'll be able to join us. And as Dr. Hopkins alluded to, we are in the planning stages with Sally Davidson out in Rhode Island of putting together an energy medicine. We're hoping for it to be almost a Saturday event, that it can be, we can all meet together at a more central venue so we can start bringing in and demonstrating to you the therapies that we are definitely using in some of our practices, from photobiomodulation to frequency-specific microcurrent. Today, Dr. O'Neill Smith talking to us about shockwave therapy, using pulsed electromagnetic fields through Beamer. So low energy neurofeedback, something that we've been using in our practice for about 6 months now, getting phenomenal results. So we would like to have a forum in the spring to really bring everyone together to actually experience and see these technologies firsthand. So that's on the horizon. And again, we hope you'll support us by going to the website, by joining as a provider, so we can have a robust website with a lot of provider resources that allow you to share what you're doing with the New England area and patients to find you. So I want to thank you all for attending. I don't know if Dr. Hopkins can still hear me, but thank her for her support of the group. And we hope to see you all in January. Thank you.
Well,
Thank you from Rhode Island.
Thank you, everybody.